Welcome to Senior Health Video. This video will talk about the symptoms of high creatinine levels leading to kidney failure. Have you been feeling tired for no reason? Maybe your ankles look a little swollen, or you're using the bathroom less than usual. It might seem like normal aging or just a stressful week. But what if your body is quietly warning you of something much more serious? Every single day in America, millions of adults over 50 wake up with signs of kidney dysfunction and have no idea their health is at risk. And here's the scary part. High creatinine levels could be the only clue. This silent shift in your blood could be the first sign your kidneys are struggling to filter waste. When left unchecked, it can lead to permanent kidney damage, fatigue, fluid buildup, high blood pressure, even heart failure. But most people never see it coming. Why? Because the symptoms don't scream. They whisper. That constant tiredness, that shortness of breath, that strange metallic taste in your mouth. Small things that are easy to ignore until it's too late. The good news is this. In the next few minutes, you're going to discover 13 powerful warning signs of high creatinine levels that are often missed but absolutely critical. Backed by science and explained in everyday language, these insights could help you or someone you love catch kidney problems early and take control before it's too late. So take a deep breath. What you're about to learn could change the course of your health forever. Let's begin. Number 1, fatigue and weakness. Feeling tired all the time, not just end of the day tired, but bone-deep exhaustion that follows you from morning to night. This is one of the first and most overlooked signs your creatinine levels may be too high. When kidneys stop filtering waste efficiently, toxins build up in your blood. This slows down oxygen delivery and energy production. A major study found that 70% of people with kidney issues experience chronic fatigue, and many never realize why. Worse yet, low red blood cell counts often develop, leading to dizziness, mental fog, and weakness. It's not just tiredness. It's your body signaling a deeper issue. To fight this, get your creatinine levels tested. Stay hydrated and eat kidney-friendly foods like red bell peppers and berries. But just knowing this one symptom is not enough, because what your body holds on to next may shock you, and you might already see it in your mirror. Number 2, swelling and edema. If your shoes feel tighter or your socks leave deep marks around your ankles, your kidneys might be in trouble. After fatigue, this is often the next big red flag. When creatinine builds up, your kidneys struggle to remove excess sodium and water. The result, fluid leaks into your tissues, causing visible swelling in the feet, ankles, legs, or even the face. One 2022 study found that chronic kidney patients frequently experience swelling due to fluid retention. And this swelling isn't just cosmetic. It can lead to pain, heaviness, and even difficulty walking. To manage this, cut back on salty foods like chips and deli meats, drink water steadily throughout the day, and elevate your legs when sitting. Ask your doctor to check your sodium and creatinine levels. But just spotting swelling isn't enough, because what happens inside your body next may not be visible at all until it's too late. Number 3, decreased urine output. After swelling sets in, the next silent signal often appears in the bathroom. If you notice you're urinating less than usual or the stream feels weaker, your kidneys might be struggling more than you think. Healthy kidneys filter your blood and remove waste through urine. But when creatinine rises, that function slows down. The result, toxins stay trapped in your body and urine output drops. This condition, called oliguria, is one of the earliest signs of kidney dysfunction. A 2021 report from Nature Reviews revealed that many patients with acute kidney injury had reduced urine flow days before more serious symptoms appeared. It's one of the body's quietest cries for help. If this happens to you, track your bathroom habits. Stay hydrated with clean water and ask your doctor for a kidney function test right away. But only noticing this symptom won't protect you, because what your lungs start to feel next could steal your breath in more ways than one. Number 4, shortness of breath. If walking up a single flight of stairs suddenly leaves you gasping for air, it might not be your lungs. It could be your kidneys crying out for help. As creatinine builds up in your blood, your kidneys can no longer balance fluids properly. This leads to fluid backing up into your lungs, making it harder to breathe. The pressure in your chest may feel tight, or you may need to catch your breath even when lying down. A 2023 study in physical activity and nutrition showed that people with elevated creatinine levels were far more likely to experience breathing problems even if they had no lung disease. This is kidney failure hiding behind lung symptoms. To ease this limit, salty foods sleep with your upper body elevated and ask your doctor if you may be retaining fluid in your lungs. But just knowing this still leaves you vulnerable because the next symptom does not affect your breath or your legs. It targets your stomach and it's harder to control. Number 5, nausea and vomiting. If your stomach feels uneasy more often than usual, or you wake up feeling queasy for no clear reason, your kidneys might be to blame. As creatinine rises and waste builds up in your blood, toxins begin to irritate your digestive system. This can trigger waves of nausea or even sudden vomiting, especially in the morning or after meals. It's your body's way of saying it cannot handle the toxic overload. A 2022 study in Kidney International Reports found that nausea is one of the most reported early symptoms in patients with reduced kidney function. Yet most people mistake it for indigestion or food poisoning and never get tested. To ease this, eat smaller meals throughout the day, avoid greasy or heavy foods, and stay away from high potassium fruits like bananas and oranges, which can worsen nausea in kidney patients. But just knowing this symptom exists is not enough, because the next sign doesn't hit your stomach. It strikes your muscles and it can stop you in your tracks. Number 6, muscle cramps and twitching. Waking up in the middle of the night with a sharp cramp in your leg, or maybe your muscles twitch randomly during the day. These are not just signs of overuse or aging. They could be signs your kidneys are off balance. When kidney function declines and creatinine builds up, your body struggles to maintain proper levels of calcium and potassium. That imbalance can lead to sudden, painful cramps or uncontrollable twitches. It can feel like your body is firing signals it no longer understands. A study from Nephrologia in 2016 showed that muscle cramping was common in patients with high creatinine levels, often linked to low calcium regulation and electrolyte disruption. To ease the tension, stretch regularly, drink clean water throughout the day, and limit processed foods that are high in phosphorus and hidden salts. But only knowing this may not be enough, because the next sign is silent until your numbers spike and your blood pressure turns against you. Number 7, high blood pressure. It may start with a mild headache or a pounding in your chest after climbing the stairs, but over time, high blood pressure can quietly destroy your kidneys from the inside out. When creatinine levels rise, it means your kidneys are struggling. In response, the body holds on to sodium and fluid, causing blood volume to increase. This puts pressure on your heart and arteries. The kidneys also activate hormones like renin and aldosterone, which make things worse by tightening blood vessels. A 2022 study in the Journal of Hypertension confirmed that elevated creatinine is closely linked to new-onset hypertension, especially in adults over 50. To protect yourself, cut back on salty snacks, monitor your pressure at home, and ask your doctor about kidney-friendly medications that won't make things worse. But just knowing this connection is not enough, because the next symptom may seem like nothing, until the itch under your skin never goes away. Number 8, persistent itching. Not all danger shows up as pain. Sometimes it starts with an itch that never stops. If your skin feels irritated, dry, or itchy without a rash, it might be more than just dryness. When kidney function declines, waste products like urea begin to build up in your bloodstream. These toxins can trigger itch receptors under your skin, leading to persistent discomfort. The medical term is uremic pruritus, and it affects up to 70% of people with kidney disease. A 2023 report in the Clinical Kidney Journal found that itching was one of the most underdiagnosed symptoms in early-stage kidney decline, often mistaken for allergies or dry weather. To soothe the itch, use fragrance-free moisturizers, take lukewarm showers instead of hot ones, and ask your doctor to check your creatinine and phosphorus levels. But just noticing the itching won't keep you safe, because the next symptom doesn't show on your skin. It hides deep in your appetite, and your weight may vanish before you realize why. Number 9, loss of appetite and weight loss. If food starts to taste dull, or you feel full after just a few bites, your kidneys might be behind it. Loss of appetite is one of the earliest and most overlooked signs of rising creatinine. When toxins like urea build up in your blood, they can interfere with digestion and suppress hunger hormones. You may notice sudden weight loss without trying or muscle shrinking even if your diet hasn't changed. A 2015 study in nephrology dialysis transplantation revealed that inflammation caused by kidney dysfunction triggers hormonal imbalances that lead to appetite suppression and protein breakdown. To fight back, try eating small meals every 3 hours, focus on high-quality proteins like eggs or tofu, and consider a referral to a renal dietitian for tailored support. But just catching weight loss isn't enough, because what's coming next might feel like simple tension in your head, but it could be your brain begging for help. Number 10, headaches, a dull pressure behind your eyes, a pounding in your temples that seems to come out of nowhere. If you're dealing with unexplained headaches, your kidneys might be playing a bigger role than you think. When creatinine levels rise, your kidneys can no longer keep toxins and electrolytes in balance. This can lead to swings in blood pressure and chemical imbalances, both of which place stress on your brain. The result: frequent or intense headaches that don't respond well to usual treatments. A report from Clinical Pharmacology and Therapeutics showed that elevated creatinine is strongly associated with neurological symptoms, including headaches, confusion, and even memory issues. To find relief, track your blood pressure, drink filtered water, and talk to your doctor about kidney-safe medications if you're taking over-the-counter pain relievers. But just knowing about headaches is not enough, because what happens in your mouth next might taste strange at first, but could be a deeper sign your blood is turning toxic. Number 11, metallic taste and bad breath. Have you ever noticed your food tastes strange, or your mouth has a metallic or sour flavor, even when you brush regularly? If so, your kidneys might be struggling to keep your blood clean. When creatinine and other waste products build up, they don't just stay in the bloodstream. They can affect your saliva and alter your sense of taste. This is why many people with kidney problems report a constant metallic taste or bad breath, often described as ammonia-like. A 2024 study in the Journal of Renal Nutrition found that over 35% of kidney patients experience altered taste perception. This often leads to reduced appetite, weight loss, and nutritional imbalances. To reduce the effects, stay hydrated with filtered water use, tongue scrapers, and limit high-protein snacks, which may increase urea levels in saliva. But just knowing this change in taste exists isn't enough, because what may be stealing your sleep at night could be your kidneys waving a red flag you can't ignore. Number 12, trouble sleeping. You turn off the lights and close your eyes, but instead of drifting off, your legs start to twitch, your mind races, or your body feels restless for no reason. If this sounds familiar, your kidneys might be disrupting your sleep, as creatinine builds up toxins in your blood, can interfere with your nervous system. This can trigger restless leg syndrome, nighttime cramps, or itching that keeps you awake. It's not just poor sleep. It's a warning sign that your kidneys are overloaded. A 2024 study published in Renal Failure found that people with elevated creatinine had significantly higher rates of insomnia and fragmented sleep even when they didn't feel sick during the day. To sleep better, avoid caffeine after 2 p.m., try elevating your legs before bed, and speak with your doctor about testing kidney function if poor sleep becomes chronic. But just being tired at night is not the end of the story, because the next symptom can hit your chest hard and might be confused with a heart attack. Number 13, chest pain and heart palpitations. It starts with a flutter, then a tightness in your chest. You pause. Is it stress? Is it your heart? Or could it be something deeper, something linked to your kidneys? When your kidneys fail to filter waste properly, excess fluid and electrolytes like potassium start building up in your blood. This can cause chest pressure, irregular heartbeats, or even sharp pain that mimics a heart attack. It's your cardiovascular system under silent stress. A major study in the Journal of the American Society of Nephrology revealed that even small elevations in creatinine were linked to higher risks of heart rhythm problems and cardiac events. The connection is real and dangerous. To protect your heart, reduce sodium intake, monitor your blood pressure daily, and ask your doctor about creatinine and potassium testing if you feel unexplained chest sensations. But just being aware of these 13 symptoms isn't enough, because how you respond from here could shape the future of your kidneys and your life. You've just learned the 13 critical warning signs of high creatinine levels that many people miss until it's too late. From constant fatigue and swelling to trouble breathing and chest pain, these are not just random symptoms. They are your body's early alert system, and now you know how to listen. But here's the most important part. It's not too late. No matter your age or your current health, you can take steps today to support your kidneys. Get your creatinine tested, stay hydrated, cut back on salty and heavily processed foods, choose kidney-friendly meals, and most importantly, pay attention to what your body's telling you. Your health does not have to spiral out of control. Every small change counts. Every early sign you catch could help you or someone you love avoid a major health crisis. If this video opened your eyes, please save it so you can come back to these symptoms anytime. You never know when you or a loved one might need it. And if you care about staying ahead of serious health problems through simple science-based food and lifestyle tips, make sure to subscribe and turn on the bell. We post new videos every week with practical health knowledge, especially for those over 60. In our next video, you'll discover 5 common foods that silently damage your kidneys, even though most people think they're healthy. You don't want to miss that. Stay strong, stay informed, and remember your body wants to heal. All you have to do is give it the chance. Save this video, hit subscribe, and share it with someone who needs to hear this today.